And our other top story tonight, West Michigan is dealing with an uptick in RSV, a respiratory virus that can be extremely dangerous in young kids especially. Doctors say those sorts of numbers are typically seen only in the winter months, what we think of as cold and flu season. But our Michael Martin talked to a doctor here in Grand Rapids who says this sudden spike is very likely due to everyone ditching their masks and social distancing. He joins us live in studio with more, Michael.
Yeah, Doug, thanks. According to the Spectrum Health doctor that I spoke to, this isn't some unique strain of RSV. It's really just a spike in cases that we don't usually see during the summer months. And you know what? This is a nationwide trend. You can take a look at this graph behind me, and that's showing the number of positive RSV cases over the last 12 months across the country. But it's a similar story here in West Michigan, where the numbers look very much the same.
It's a virus we usually see during the winter months, but this year we're actually seeing it during the summer.
RSV, or respiratory syncytial virus, is a virus that presents to most adults like a cold. It's something we usually start to see spread in the colder winter months.
The problem is in the very young kids, it can become a lot worse. They have difficulty breathing, they breathe really fast, their heart beats really fast, and they look like they're in a lot of distress.
According to the CDC, positive cases of RSV are on the rise, not just in Michigan, but across the country, as you can see from these graphs.
Well, we're kind of scratching our heads a little bit.
But many health experts, like Spectrum's Dr. Daniel McGee, believe the spike has to do with folks ditching their face masks.
We got to break this winter. We saw very little RSV because everybody was masking and social distancing. And now that people are getting outside, getting together, taking off the masks, we're starting to see viruses that we normally see during the winter months.
Dr. McGee says this isn't any sort of bizarre, unique strain of RSV we're seeing right now, but can still be extremely dangerous if caught by a younger child.
Children don't have to be seen in the emergency room every time they have a cold. But when they do need to be seen is when they're having difficulty breathing. If your child is working hard to breathe, if your child is not taking in adequate amounts of liquids, then your child needs to be seen.
The best way to avoid catching RSV, fall back on those habits we all got so familiar with over the pandemic.
I think we should always be washing our hands when we get the chance and not coughing on people, covering our mouths when we do cough.
Because there is no vaccine or instant cure for RSV.
The treatment for RSV is more symptomatic care. We help the child to breathe via oxygen or other means, but there's nothing we can do to make the RSV virus go away any quicker.
So again, Dr. McGee is saying that the time to take your child directly to the hospital is as soon as you see them struggling to breathe or notice that they're not drinking enough liquids. For now, live in the studio, Michael Martin, Fox 17 News.